Okay, let's continue with hookworms part 8. Didn't know there was going to be part 8, but I forgot to talk about Lyme disease and hookworm. So let's do it. This is what they call a Lyme heat map. And even though the bacteria has been cleared with antibiotics, you see over the months there's real no decrease in the inflammatory response. You look at the percentage of blue, which is low inflammatory cytokine signals, or red, which is high inflammatory. The percentage of blue to red does not change much. And that's what a lot of patients experience. They might have had Lyme, had some antibiotics for Lyme, but they're still symptomatic. And I certainly have seen that in many, many people throughout the years. However, there may be a possible resolution. Hookworms improve malaria. So why am I talking about malaria is they haven't studied hookworm and Lyme disease. But malaria is not that much different. Intracellular parasite versus intracellular bacteria. Same series, same pattern, waxing and waning course of inflammatory symptoms. And what they found was that when someone had hookworms, they had higher nitric oxide concentrations. Nitric oxide's important. They've studied it in hospitals, and the higher nitric oxide, the more resistant to disease you are. So they found that people that had hookworm infection had a higher ability to protect themselves from intracellular parasites and bacteria. And they found the patients with hookworms had better outcome. That helminth infections are associated with protection against malaria, renal failure, and jaundice. So that makes sense when you look at kind of the history of hookworm and its evolution with bacteria and viruses throughout our history. In fact, if you look at Lyme disease even, when they defrosted the Iceman, Ozzy, from 5,000 years ago, they found that he had Lyme. And in fact, recently they found a 50 million year old tick trapped in amber, and when they examined it, it was carrying the Lyme bacteria. So the Lyme condition is really nothing new for our bodies. I don't mind the dryer being on in the background, but when the zipper starts scratching against the tub, we've got to do something about it. Anyway, if you look at Lyme disease, it's something that our ancestors were exposed to. And in fact, if you imagine them living closer to nature, if you've ever been camping or a kid and pulled ticks off yourself during the summer or while going through the woods, our ancestors were exposed to Lyme. And if it had knocked them out that easily, we wouldn't be here. So what's changed is we are more inflammatory in our reaction to the presence of the Lyme bacteria. It's more pathogenic because our body reacts more strongly. And that is because we don't have the worm population moderating our inflammatory response. You guys got all that? So here's mast cell syndrome, treating patients with hookworms. Basically, they did a big study with antibiotics and Lyme disease because there was some belief system in the alternative community that antibiotics could cure Lyme, and the insurance companies just didn't want to pay for it. And that may or may not have been true. But I believe the study, and what I've seen in practice, is even long-term antibiotics don't resolve the problem, because the problem is not the presence of the Lyme bacteria. It's our overreaction to it, and the antibiotics do nothing to solve that. That doesn't mean antibiotics can't help with acute Lyme flare-ups. They definitely can and should be used for that reason, but the underlying cure is a different level of thinking. I found this slide really interesting. It compared kind of the different signals that our immune system uses with different diseases and or autoimmune diseases, infections or autoimmune diseases. And what it found was there's a lot of similar signaling. For example, here's Lyme, here's lupus. There's a lot of similar signaling in conditions we call autoimmune and conditions we call infectious. In fact, I think they're exactly the same thing, T cell receptors. So, kind of interesting, huh? You could look at that slide as much as you want, and I hope this helps you think, oh, I did have a woman that managed to get some hookworms. She had had Lyme for several years and had a severe allergic reaction to it. I don't know. Now let me put it this way. After Lyme, she got severe allergies to the extent that she would go through a box of tissues at night, waking up multiple times. And she suffered with this for a couple of years. She tried multiple Chinese herbs, Western herbs, Ayurvedic herbs, drugs, pharmacy, antibiotics, etc. She wasn't willing to try anything. And then she kind of gave up hope and got herself some hookworms. And as soon as she got the hookworms in, the allergies stopped. And they have not come back. And we've been monitoring her for close to 3 years now with no return of symptoms. With no other, she hadn't done anything else but give herself some hookworms. So, pretty darn interesting.